Hello and welcome back, everyone. I hope you've enjoyed all of the amazing sessions. We've certainly covered a huge amount of ground so far, but there's still a lot more to come. So we're now commencing the final theme of today, which is about federation and taking a look into the future. I'm going to start this conversation with Doug Gurr about how will data transform the future of healthcare. So I'm just going to give a little bit of Doug's bio because it's got quite an extraordinary one. Doug is the chair of the British Heart Foundation, and until last week was the country manager of Amazon UK, and has been previously president of Amazon China, taught mathematics and computing at the University of Aarhus in Denmark, grown an internet startup from nothing to $250 million in 5 years, and spent 5 years on the board of Asda Walmart. And that's along with a whole experience of Ironman and skiing and everything else. So all sorts of very exciting things, Douglas. But today is also the first day in your new role as director of the Natural History Museum. So thank you for joining us, particularly on this your first day. You must be incredibly busy today.
It's an absolute pleasure to be here. But no, it's actually quite good because I've been sort of de facto doing both Amazon and the Natural History Museum for the last 2 months. So actually today I feel I've only got one job. So things if anything are a little bit easier. Anyway, it's a pleasure to be here with you all.
Well, so I've got a series of questions, which I'm going to, all sorts of things I want to ask you, but we're also then going to have inputs from the audience. So people, please do feed in questions you have for Doug as we go through the conversation today. So first of all, I wanted to ask you about your move from Amazon to the Natural History Museum. So two quite different organisations, seemingly from the outside. It'd be great to hear about the parallels between them and really what your thoughts, what the role of data is in each of them as well.
Great. No, well, thank you very much. Yeah, so I think it's, you might argue it's a little bit of a left field move, but for me personally, I've been involved actively in museums for over 20 years. I was on the board of the Science Museum next door and chaired that for 4 years. And really, when I saw what the Natural History Museum was trying to achieve, which is sort of saying, look, we've got some real challenges here in terms of, the impacts on biodiversity on the planet. And Natural History Museum, and this comes back very much to data, has a couple of really interesting assets. It's obviously got an extraordinary collection, over 80 million objects, which is roughly 27% of the entire planet's natural history collection. And I'll come on to quite where the data and digitization comes into that. Obviously, it's well known as a visitor attraction and has the opportunity to communicate with many, many people. It's perhaps less well known as a reasonably serious world-class scientific institute. We have over 300 scientists here doing all of the work on both life sciences and earth sciences. So it's both answering questions about how do we actually address some of these kind of challenges. And as the science team would put it, in particular, how do we look to nature to try and come up with solutions for nature? And I think that takes us right to the heart of the data question, which obviously we've been talking about a lot today. Because if you take that collection of 80 million objects all together over the last couple of 100 years, the good news is the team has started an amazingly important digitization program here. Good news is because a lot of our scientists are by training, they're trained in taxonomy and systematics. They've actually done the hard bit, data structures really, really well. The bad bit is actually just cranking through 80 million objects takes quite a long time, particularly when some of them are like 8-meter giant squids or little beetles or things like this. So it's a complex scaling problem. But actually, if you can crack that problem, it opens up really exciting opportunities. And I'll just give you one, which is some of our scientists are looking at questions around how do we feed the world in a more sustainable way. And if you take a crop like wheat, they've just completed the work to do the full genetic sequencing of all of the current wheat varieties around the world. It turns out there aren't that many. But actually, interestingly, all of the current extant popular wheat varieties have tended to be those that have been self-selected or selected because they work incredibly well when you have very high levels of fertilizers and pesticides. So in other words, we've ended up with varieties of wheat that are very effective if you put a lot of chemicals in, but are not actually particularly effective if you don't. And actually, the only way to get back to asking the question of could we continue to feed the world as effectively with less environmental impact by lower use of pesticides or fertilizers is actually to go back into history. And that's what you do through a collection of 80 million articles. So the team right now are going back digitally through all of the data we have, the genetic data you can actually pull together, asking the sort of basic question around are there varieties of wheat or what are the candidates for varieties of wheat that might flourish, with lower levels of chemicals. So that's the kind of interesting questions you can address, but you can only do it if you've got really, really big data sets. And so there's an interesting scaling problem for how do we pull those together.
Absolutely fascinating. And just before we came onto the call, you mentioned that the number of skeletons as well that you have in terms of that. So obviously the human aspects of it. We were in one of our previous conversations talking about the kind of 100-year period of some of the cohorts that have been running in the UK. Obviously, you'll go back a lot further in time over there. What sort of information will we be able to learn from those sorts of sources?
So it's a great question, and in some ways, the collection's been pulled together over the last couple of 100 years. But some of the artifacts in question go back, over geological time. So we have all the fossil records. Obviously, we've got dinosaurs and things of 200 plus million years old. But I think one of the really interesting questions you can ask is if you take something like the insect or the beetle collection, which is vast, widespread. But the good news is it's actually pretty well categorized in terms of we know the provenance, we know where things were collected, we know when they were collected. So actually you can digitize all of that at scale, and some really interesting work on that. You can begin to ask yourself basic questions around, how has biological life responded to changes in environmental conditions, external environmental conditions. So what happens when you have a material change in climate, or you have a material change in ocean acidification, all of these things, because you've actually got all the stuff that was dug up from the ocean floors in the 1880s on the Challenger expedition. It's all stored here and properly captured with the right metadata. You can start to take those really interesting longitudinal slices. And with enough data, which is why it really matters that you've got 35 million beetles sitting there, you can actually start to begin to do, as we all know, you can start to get to a scale where you can train machine models, you can begin to come up with some really interesting predictive stuff. And a lot of this stuff, as we know around data, it's not that the models are that complicated, you just need a lot of well-indexed, well-tagged data to train the models. So actually you've got a chance to actually go back through time, look at the response of, in this case, biological organisms to changes in external environments, begin to build really interesting models that will start to predict, what's going to happen in the future. Only ever predictive, but actually that begins to point us towards the way of, well, what are the solutions we need to look for, so we can perhaps mitigate some of the threats we see right now.
It's just the kind of potential of what we can kind of learn through this could be really, really extraordinary.
Oh, it's extraordinary. I mean, it's, as I say, that was what attracted me to come here. If you like, take some of those sort of classic sort of big tech toolkits, which have only really become available to us at scale. I don't know, the last sort of at best 10 or 15 years, and some of those even more recently than that. So to actually start to deploy those technologies and those, all of that sort of smart stuff, start to deploy it to effectively data sets that go longitudinally over time, go around the world, carry an extraordinary richness if you sort of capture it. I think that's this is going to, I have a very high level of conviction this will transform our view of the world and transform our view of some of the actions we need to take.
And if I can kind of probe a little bit further, what sorts of transformations would you predict at this point in time? If you had your kind of crystal ball, what sorts of things, and particularly drawing on perhaps some of the sectors where you've seen the transformations already happen, what might we be seeing in healthcare coming up, or what should we be looking out for?
Yeah, so it's a great question. So if you look at healthcare specifically, and obviously this is a question that we've been scratching our heads over for a few years at the British Heart Foundation, where one of the reasons that we started 4 or 5 years ago down on the journey of saying, right, what impact is data science going to have on healthcare? And in a sense, in some ways, if you sort of say, where do we stand today, it's remarkable how little we've done. If you look at the way in which we've deployed technology to pretty mundane areas like shopping and dating and things like this, it's been utterly transformative. If you take healthcare, the most simple way I'd characterize this is that on the whole, the last couple of thousand years, healthcare has been primarily reactive because we have to wait until patients present, and we have to wait until they present with detectable symptoms. And very often that means physical symptoms. And that quite often means that we make our interventions reactively, we make them quite late. So whether you're dealing with cancer, which by definition, we know the earlier we capture it, the better prognosis, or our particular area, which is cardiovascular diseases, how can you actually discover genetic predispositions or emerging issues or potential stroke? So you've got all of these things where you catch things late and you catch them reactively. And, you know, one of the things that and if you then approach that challenge and you say, well, let me treat, you know, presentable physical symptoms as a machine learning problem, you very quickly say, look, it's just a classic, you know, how can we work out the inputs that correlate with these outputs? You know, we with a very high level of conviction, if you were tracing what we would describe as input data, that would be things like blood pressure or continuous sampling, glucose levels, or whatever it is, there'll be a whole load of sort of indicators that, you know, with the right training data sets, you'll be able to correlate to as predictors of disease. And very rapidly, you'll move medicine, frankly, from being a late stage reactive to a much more early stage predictive and earlier intervention. And I think a lot of us have very high levels of conviction that we know the prognosis is much better if you intervene early. And so I'll give you two very simple examples of that from the cardiovascular space. We already have and have developed a $40 genetic test. So this is just static genetic data, it doesn't require any real-time data, but that actually predicts with a pretty high level of confidence your lifetime predisposition to cardiovascular disease. And, you know, you can take this test, it's $40, you can take it at the age of 12, 6, 7, 8, 12, and it will, you know, frankly tell you which of 3 cohorts you're in. And if you're in the good cohort, fantastic, your lifetime risk is 15%. If you're in the bad cohort, your lifetime risk is 85%. And knowing that, we believe, is likely to influence behavior, because if you can get at the age of 15, 16, you know, a suggestion that, listen, here's your overall lifetime risk, it's much more likely you'll start to make those really hard, small incremental changes to diet, behavior, all of these things we know are super hard to do. So I think that's one simple example of what you can do just by being able to personalize the risk level on lifetime risk of cardiovascular. Another simple example I'll give you is, if you look at the number one reason why patients present at A&E departments globally, and certainly true here in the UK, it's chest pains. And we know that a proportion of those patients presenting are likely to be having maybe having a heart attack or a stroke. Good news is we have a test. We monitor for a protein called troponin, which I'm sure many on the call will know about. And it turns out troponin leaks at higher levels from a damaged heart. So that actually, if you monitor your troponin levels, you've got a good chance of saying this patient really needs to be brought in, and perhaps they need a stent, or perhaps there's a blockage, or, you know, an early indicator. And if you monitor it, it's fine, you can send them home. And the differences in that decision are very material, because we know that survival rates of heart attack in hospital is 80%, survival rate of heart attack outside the hospital is 10%. So this is literally, it sounds a bit melodramatic, but it's a life or death decision to make. So that's the good news, we have a test. The bad news is to get enough, to get a reasonably good predictive level, you need at least 48 hours of monitoring data. And in a crowded A&E department where you're making the admit, go home decision within 4 hours, that's just no good. So effectively you're guessing. And if you guess wrong, consequences are not good. Now, so that's situations as it stands today, that's the standard protocols. We've been funding a team up at Edinburgh who's basically said, let's take full population data from Scotland, where we have good linkages between primary and secondary healthcare and all of these sort of things. It's a 6 million population. Let's look at those same troponin assays, but let's try and overlay them with, you know, a whole lot of other data we can collect, you know, pre-existing medication, age, gender, demographics, etc. And they've now got, you know, at least lab proven, not yet clinically proven. What they've shown is that if we take a whole load of these extra input data, they've been able to build a predictive model that has the same level of false positives, false negative, but can give the same results in 3 hours, not 48 hours. And all you need to do is capture some basic data at admission, run the same troponin assays, and in 3 hours, you'll get the same predictive data we've previously been able to get in 48 hours. That's transformative. That will, you know, it's deployable very quickly, it's rollable outable. It could be done globally. Obviously, we'll have to look at different cohorts because, you know, the Scottish population may not be fully represented in the world. But in principle, you've radically changed the quality of frontline clinical decisions in terms of the accuracy of, do we admit the right people and then we can treat them, and do we send people home? So that's sort of simple examples of how actually we're really quite close, I think, to beginning to radically transform how we think about use measurements.
So those are great kind of practical examples and things of the kind of and really will be transformational, and that's just in one disease area. So you kind of then take across the full range of possible conditions and things. one thing we haven't kind of touched on yet is around the kind of the aspects of the ethics, privacy. We've had quite a lot of conversations around kind of representativeness of data. So I don't necessarily need to touch on that, because I think that's quite a well-known kind of challenge and things in there. But I really want to kind of talk through the perhaps some of the privacy aspects in terms of how data is being used, and also kind of perhaps draw back into your Amazon experience of just how you thought through it in that kind of context.
Yeah, it's a really important question, and for me, it falls under the class. It falls under a category of questions that are not new. They're common to a lot of new technologies, and I'm passionate believer in technology. But the common thread we get is, here's a new technology, properly deployed, we believe it can deliver genuine benefit. However, like a lot of new technologies, it will raise all sorts of interesting and legitimate societal questions, whether it's privacy or equity or sort of equality or safety. And these are absolutely legitimate questions. And in many cases, and it's not the first time we've been here, we went here with human genome, human tissue research, back in the 1990s. We've had it with sort of genetically modified food. We've had it with all sorts of interesting questions around data science. And I think the art of this is to say, listen, we need to come up with an appropriate regulatory framework, and I do believe you need a regulatory approach to this. An appropriate regulatory framework that meets and addresses the absolutely legitimate societal concerns. Privacy is a great example of a legitimate societal concern, but does so in such a way that creates the maximum possible scope for innovation. And I think it's very interesting if you go back through time and you look at the Warner Commission back in the 90s and all of that. We did that really well. And you could argue that's one of the reasons why the UK became a world leader in life sciences. We came up with an appropriate ethical framework for questions about human embryo research. We're right at the point of trying to define the appropriate ethical framework around data privacy, what's okay. They're not easy questions, but we're not far off it. My general view is, actually, I don't think GDPR is miles off. You can see the principles. Transparency is super important. Control is super important. All of this. And I think actually, if you speak to, by the way, we've done quite a lot of work on this with patient groups. If you speak to patient groups, the default assumption is, don't you dare, don't share my data, all of those obvious reasons, etc. And health data is probably the most sensitive class of data. But actually, if you can properly come up with a framework and say, well, for what purposes are we using it? Are you okay to have your data shared? Does it need to be personally identifiable? Could it be anonymized or pseudonymized? And are you willing to use this to actually drive forward medical research? On the whole, I think you can get much higher levels of consent. So it requires that sort of thoughtful framework, but that's kind of all it requires. And whilst that's not a trivial problem, and I wouldn't claim it's a trivial problem, it is a soluble problem. We've been here before, we've seen it in other areas. And we're actually probably about 80% of the way towards this. We just need to nudge it over the line to say, like, here's the appropriate framework for defining who sees what, at what granularity, with what transparency, with what level of control.
And that brings in a nice question here we've just got from Aidan Doherty around, so what would you view as the healthcare challenges and opportunities of integrating non-traditional data sources in an appropriately consented manner? So and I guess we've seen through COVID that kind of explosion of different data.
Yeah, it's a brilliant question, Aidan, as ever. I think I'll tell you what I think won't work, which is you often get this approach that we need to kind of somehow create this huge data lake, this master sort of database that has everything in, and we've seen a lot of that in some of the work we've all been doing around COVID. Things like this, and that really won't work for a whole load of reasons, partly technical, but partly what is ethical. So I think what really is the challenge of saying is, listen, different organizations and institutions will have different data sets and should keep those data sets. So for example, a trust will have certain data, a GP will have certain data, HDR UK will have some extraordinary data. The value comes very often from saying, how do I actually pull, certain sets of data from all these different sources? So it may well be, if we want to look at things like testing drug response or vaccine effectiveness, we actually really need to know, well, what happens when we administer it to this class of patients in this hospital trust. We don't necessarily need to know who the individuals are, because we're not trying to use it for individual treatment. We just need to need it for population cohort responsiveness. So effectively, that's where you get into appropriate hardened API calls, data structures that define the framework for for this purpose, it's okay to poll this trust data to share with this institution for this purpose. That's kind of really where you get it right. Where you get it wrong is you somehow create this, either you go down the crazy technical challenge of pull it all together into one big master database, which is never going to work and nobody would ever accept anyway, or you're unclear about what you need it for, and that's where you'll get yourself into a sort of a rat hole of privacy implications. If I don't need to know who this is for, then all I need to care is about some basic data. If I want to use it for individual personalized treatment or guidance or advice, then I need to know who to send it to. But that's all I need to know. So I think those are the kind of good examples of where we get to. But the general approach has to come from lots of different data owners, good structures, appropriate APIs, and then crucially that layer of who gets permission to poll which data at which point in time for which purpose. So a non-trivial question, but again, a question we had to solve in other domains. We just haven't quite got it over the line in the health domain. And unfortunately, this is probably both the most important and the most sensitive one to solve it in.
And that brings on to a question from David Seymour here, which is around health data curation. So you touched on at the start, effectively some of the lessons from museum curation, but I guess in terms of also from your Amazon kind of work on that, what should we be looking at in as we're considering the health?
Really good question. And again, David, people sometimes define curation in different ways, but I think there's a couple of interesting things that are hard problems you need to solve up front, and if you get them wrong, they're horribly problematic. So things like, what is the data schema, what is the technical architecture, what are all the elements you're going to create? That's a really hard thing to solve if you don't get it right. So that for me is worthy of a lot of upfront thinking about, at the level of the individual or the drug or the whatever, what is the different types of data we need to collect, etc. So that's a really important hard problem to solve. I think the other bit that we've learned a lot from sort of curation is as we all know, data's never clean, it's always a bit messy, it's always scrappy, you've got massive deduping issues, you've got all sorts of errors. I think what's really interesting is you can do a lot these days with really being thoughtful about how you use the combination of machine and human curation. Because actually machine curation, has pros and cons. The con is it's like everything else, it's probabilistic, it's not perfect, you may get it wrong. But it can work at incredible scale incredibly quickly. So actually you can do a first pass, pretty accurate, let's really deal with the deduping, do this, that, the other, do the curation using automation, all those classic sort of train good machine learning model. And then actually interestingly, you can come in and just say, right, now let me use the human curation to solve the edge cases or solve either the instances where it really matters we've got it right. But actually what's much more powerful is you come in and say, let me use the human curation to retrain the models. And like all these machine learning models, they go stale, they need retraining, they're only as good as test data sets. So actually, I think being really thoughtful about how do I really use my human curation to drive better automation through this, that can actually radically improve the quality of your data, it can infill lots of missing gaps, it can do all that sort of stuff where you can do a lot through inference. If you've got good machine learning, but you've always got to be paranoid about how you're going to inspect and audit the performance of these machines, and that's where I think we need to do. There's huge value in human curation, not to try and solve problems at scale, but human curation in order to train machines to work more effectively at scale.
Yeah, really interesting, and I think we'll have to learn how to get really effective at doing. There's a whole range of different aspects of data.
Yeah, and it's a hard problem, but look, it's the kind of thing that if you take it, those techniques are existing techniques that you deploy to things like how to improve image quality on an online catalog, how do we actually spot potentially fraudulent purchase histories and so on. So there are lots of very analogous problems that we know have been solved using their techniques. It's more just how do we think about deploying some of those techniques to what's effectively new domains, but with, as you rightly call out, with a much sort of healthier level of skepticism and paranoia, the need to sort of get the ethics right and get the privacy right.
And if I can take you back into the world of Amazon a bit, and obviously the last one of the things we've been exploring is the kind of extraordinary last 6 months or kind of 7-8 months now that we've been through. Amazon has clearly had an extraordinary period of time as well. I mean, we saw the kind of profits tripled in the last quarter. So what was that like for you and your colleagues of effectively not the money increase, but more the kind of the burden of work and things that must have
well, look, it was I mean, I think it's been extraordinary for everyone. It's been a really weird sort of last 6 months, and probably 2020 is a year quite a lot of us would be quite glad to say goodbye to, because it's created all sorts of challenges. I mean, look, from our From a personal point of view, it was super busy. Things go slightly insane, and that forces you to be very focused on what really matters. And in the end, it forces a discipline of just saying, look, what really, really matters. And it ended up coming down to just three very simple things. I mean, first, we were being asked very clearly by our customers and by governments around the world and by regulators to keep operating, because we knew, for example, back in March, April time, that unless we could keep delivering, people couldn't self-isolate and stay at home. So there was a real, please keep operating. But we knew we could only do that if we could keep our people safe. So priority number one was, how on earth do you run an operation at scale safely? That was a lot of work. That involved, I think, over 150 different process changes to bring in social distancing in the performance center, masses of PPE, temperature testing, etc. I think we've gone public recently about the fact that we rolled out in-house coronavirus testing for all of our employees in the US and the UK. And that involved, by the way, look, we've never done medical testing before, but from standing start, we've spun up testing labs. We've got one running up in Manchester now that actually does all of our employee testing. So there was a whole load of like, wow, you've got to move fast to keep people safe, and touch wood. That seems to have worked pretty well, and obviously we're monitoring very carefully sort of infection rates across our population. We're feeling pretty good about where we've got to on that. I think there was a piece where it just got busy, and we probably are. And then, by the way, that was fascinating because there's always this sequence where day one it's always new role. So like, oh my goodness, we're going to lockdown. I need new role, I need medicines, I need these things, I need food. And then you're thinking, oh crikey, they close the schools, I need educational materials. We've all got to become home tutors for our kids and things like that. And then it gets into the summer and it's all board with us. Sheds, DIY stuff, outdoor swimming pools go through the roof, and on it goes. So at some point, there was just something that was going crazy somewhere. Actually, interestingly, of course, home office equipment. We've all had to go and buy more microphones and webcams and all that sort of stuff. So it's just like, this is just completely bizarre. But in many ways, it was just a classic supply demand. Our capacity was down a bit because of all of the process changes we've had to make to keep the operation safe. Capacity was through the roof. And it was interesting day-to-day juggling. And actually, what was really interesting about that was seeing what scales and what doesn't. And one very clear
what doesn't, yeah.
Well, at the most basic level, machine scale, people don't. So every process that worked through automation scaled brilliantly, and every process that required scaling through linearly, people just didn't. So actually, it really forced us to look harder at our own operation, just say where had we done a good job and a less good job of really moving to that that happy state where people are doing the things that people are really good at, and machines do all the stuff that machines are really good at. And the good news is that tends to be the more boring, routine, repetitive stuff. So if you do it well, you make more interesting jobs for people because it's the creative, the thoughtful, the other. But it also tells you what doesn't scale. And then I think the final piece of it was just look, keep people safe, keep operating. It was then just trying to be helpful and respond to the many, many requests we got for help from different organisations. So in the UK specifically, we worked for many years with a charity called Magic Breakfast, which feeds kids in schools who otherwise would be too hungry to study. They had a huge problem that obviously when kids went home from schools, they had no way of delivering meals to people. So we actually dedicated an entire sort of operation just to working with them to be able to deliver either direct to homes or into communities. And I think we've fed up 200 kids during the course of this year, to sort of 2.5 meals over the course of this year to keep that going. Then obviously, home testing. And again, we got a call early on from sort of Prime Minister and Matt Hancock saying we're trying to roll out testing, and we've been doing all of the home deliveries. I think we've delivered over 4 million home testing kits now. We haven't charged anything for that. It's all been done for free. So but again, actually just getting that up and running in days from the standing start was pretty challenging. So, but it's. So it was busy, but actually, teams responded incredibly well. And, I think, I don't think any of us here, I think all of us are acutely conscious that the organisations are in a much worse state and we've had a much harder time. And on the whole, we would rather be busy and still operating than facing the challenges that some had to face. Yeah.
Mm.
Certainly a year we won't forget in a hurry, I'll say that.
Don't think any of us will. And there's a nice question here, which I'll finish off with, which is, so from the perspective of someone who views across places like Natural History Museum, British Heart Foundation, Amazon, how do you think we recover from the current crisis? And what do the next couple of years look like?
It's a really good question. And I think it's, you don't want to fall into the sort of trivial mantra of the sort of build back better type thing. But what I would say is this, which is, look, we've gone through a period of radical behavioural change. forced behavioural change, and some of it is just in the way in which we're doing this online, virtually versus that. But if you just think through all of the things that each individual has had to change, or each government or each company has had to change about their ways of working, it's radical forced behavioural change. You know, and that raises that gives us the opportunity to, at least before we revert back to the way we were before, it gives us the chance to ask the question of, is there anything we liked about that change? And before we sort of slip back, is there anything where we would pause and just ask ourselves, well, maybe this is a better way? So I'll give you one simple example, which is, again, from the BHF perspective, we're a medical research funding charity. Quite early on in this crisis, beyond all the patient data and consent that we wanted for, we've been funding quite a lot of research around, we've known for a while, for example, that pollution is one of the clear contributors towards cardiovascular disease. And we've had an opportunity now to look at what the world looks like in which cities are much quieter, pollution levels have dropped radically. So we actually went out there and did a ton of work to fund research around, you know, what do we think the implications for long-term health will be in a world in which there's less travel, less impact on all of this. And I think that will help to inform questions about, before we necessarily move back, maybe there is a slightly different way. So I think if you want the optimist in me, I think I'm cautiously optimistic that we will at least be thoughtful about saying, before we automatically go back to the way we are before, we'll look at all the changes, ask ourselves which ones do we like, and hopefully we'll retain a few things that will be seen as positives, in which case, you know, 2021 could be a pretty good year, once we're finally through all of the current crisis and lockdown. But then I'm generally an optimistic person. That's what I would say.
Me too. So let's go with that. Seems a good place to go with on that. Thank you so much for your time, particularly on your first day at in this new role. And I hope day 2 goes really well as well. So and thank you for such a thought-provoking conversation. I could have talked for so much, well, not me talking, but could listen to you for so much longer and ask so many more questions. I apologize to those whose questions I didn't manage to get to in the time, but what a great conversation. So we're going to thank you. So we're now going to have a break for 10 minutes, everyone, and we'll be rejoining at 3:10 into the final breakout groups for the afternoon. So thank you all for joining us.